Hello, this is Dr. David Bilstrom from the International Autoimmune Institute and the Autoimmune Lifestyle. And this is Did You Know? Coming to you from the Big Island. Oh, my manners are atrocious. Aloha. Coming to you from the Big Island of Hawaii today on the Kahala coast. And we're talking once again about autism spectrum disorder as an autoimmune disease, as well as cerebral folate deficiency, folate being B9, one of the B vitamins. And oh my gosh, this article that we've done some videos on already is just chock full of great information. Plus we got so many videos to talk about. So once again, the article is from the Journal of Personalized Medicine in July of 2021, folate receptor alpha autoantibodies in autism spectrum disorders, diagnosis, treatment, and prevention. Now, remember, we're not splitters, we're lumpers. So this is about brainy stuff, right? Now, there's a lot of autism. Now, in the US and Canada, it's 1 in 50 children have autism. Worldwide, it's 1 in 162. Oh my gosh, we got so much brain stuff, autism spectrum disorder, developmental delays, Asperger's, all this kind of stuff, right? Oh my gosh. So remember, video we talked about before about this article, there's not a gene for autism spectrum disorder. It's epigenetics, which genes get turned on and turned off, and we're going to talk about this. You got to optimize epigenetics in the patient, in the parents before conceiving a child. Ideally, you want 1 to 2 years to flip genes the right way in both man and women before conception in order to prevent disease in the offspring, but also the next 6 to 8 generations. So this is all that papaya stuff. Remember our mantra, papaya. Prenatal, before conception. Antenatal, during pregnancy. Pediatric, young kids. Adolescents, young adults. You want to optimize epigenetics ideally before conception for the next 6 to 8 generations, but you want to do it each step in life. Now, the presence of folate receptor alpha antibodies, the autoimmune disease that attacks folate receptor alpha, being present in the parents before conception. Okay, I'm going to go to this figure here. Now, if both mother and father are positive for the folate receptor alpha antibodies before conceiving a child, the prognosis for the child, severe autism, poor prognosis, irreversible. Yuck. Now, I like to think nothing's irreversible, but yuck, if both parents are positive for this autoimmune disease, right? If the father's negative but the mother's positive, severe autism, partly reversible. That is pretty scary too. If the father's positive and the mother's not positive for the folate receptor alpha antibodies before conception, moderate to severe autism, variable prognosis. None of those sound good, right? Some are worse than others. So important. Now remember, if you're reversing autoimmune disease in the parents' folate receptor alpha antibodies, you're really reversing all autoimmune disease, right? No matter what they got. Now, if both parents are negative, is the kid cool? No, that's not right. Because if both parents are negative for the folate receptor alpha antibodies before conception, but a child starts consuming animal milk-based products like cow's milk, will trigger high folate receptor alpha antibody titers and low cerebral brain folate, infantile cerebral folate deficiency. Starts at about 4 months of age with irritability and sleep issues. Anybody know any kids at 4 months of age or older with irritability and sleep issues? Really common. And then if it doesn't get fixed, severe neurologic issues, even visual problems and hearing problems. Know any cute little kids that wear glasses at young ages? Know any kids with hearing issues at young ages? Super common. So, also introducing animal-based milk products, it could end up acquired infantile autism, early diagnosis and treatment, favorable prognosis, okay? But what about if you breastfeed? Breastfeeding, you can't do anything better. Will that protect the child from this autoimmune disease? No, what they find is that breastfeeding actually, and then you introduce cow's milk proteins or animal milk proteins after being done with breastfeeding, regression to autism. You actually can get autism because of those proteins that are in the cow's milk, dairy, and animal dairy products. Let's prevent it in the first place, but we now know what we're looking at. Let's try to get at it right away if it shows up once the kids are born. Better to prevent it, but let's get rid of this autoimmune disease before it really messes up the brains of young people. Thank you so much.